my beautiful doctor. Say hi. Okay,
Hello.
she gonna explain my surgery.
All right, so this picture on the wall here is going to be of a gastric sleeve.
Yes.
So just to give everybody some context, this is your whole stomach. This is your liver, your gallbladder, this little green bag here. This is your large intestine here. This is where the poop comes out.
Yeah.
This is your small intestine, and this is where you start to digest food. Okay? With the procedure, we make 5 small incisions in the stomach, in the abdominal wall, and then we fill the belly up with air. Really, for this surgery, we're only operating on the stomach.
Yes.
Right? We'll take a look at all your intestines, we'll take a look at your liver and your gallbladder, but we won't do anything to them specifically.
Okay.
For the first part of the surgery, we actually divide up all the attachments that are going to be on this lateral portion of the stomach. This is called the greater curvature of the stomach. So we remove all the attachments there. This is the lesser curve of the stomach. This is what's going to be left behind.
Yes.
Okay? Once we remove all those attachments, we use a special stapling device that actually staples and cuts at the same time. So we start at the bottom of the stomach. We use that special stapling device, and it'll staple and cut. We use another stapler to go up, another stapler to go up, another stapler to go up. We also put a special sizer down so that we don't make the stomach too small.
Right.
So that sizer will be in place as we use the stapling device. And then once that portion of the stomach is completely divided off, because remember, we took off all the attachments here,
Yes.
and then now we've divided it here, so this whole thing should be free. We take that out to one of your largest incisions, and then you're left behind with just that tubular shaped stomach there. So again, essentially you're turning your stomach into about, from the size of about a small football to about the size of a banana.
Okay.
And that's the gastric sleeve. Very good.
So that's
Where
very
all them gas went? Where all the acid went?
So that's actually a very good question. So normally in a larger stomach, you actually have a lot of room to produce acid.
right.
Right? After a gastric sleeve, because the stomach is a little bit more tubular shaped, there is risk that you could have reflux afterwards. Because this ends up becoming a smaller, inside of it is smaller. So sometimes patients can have acid reflux that goes back up into their esophagus. The hope is that with the weight loss, that should help to reduce the acid reflux. But there are some people that can still develop it afterwards. Those are the patients that are going to have to stay on those acid suppressing medications.
Yeah.
That's also why we give it to everyone after surgery anyway, to help minimize all that risk. But you still have a good, decent amount of volume inside. The lumen of the stomach is going to be something about like that, as opposed to it being that big in a normal sized stomach.
Yes.
Yeah.
And then
Other questions?
for they say I can't have aspirin. I just want to know why.
So, if you had aspirin, every now and then, it's not the end of the world. But
Yeah.
this is for I'm taking it every single day.
Yeah.
What aspirin does is it actually can cause ulcers,
Oh.
right?
Okay.
So taking a combination of aspirin and having high acid production is kind of like a setup for an ulcer,
Right.
right? And let's just picture, say if you had an ulcer in a big started stomach somewhere over here, and you're not gonna have that anymore. So having an ulcer in your stomach that's significantly smaller
Yeah.
can be a lot more detrimental. So
Yeah.
any kind of NSAID medications, ibuprofen, Motrin, Aleve, aspirin, you want to take those very, very sparingly.
Yes.
Preferably, a lot of our patients who, are still menstruating or anything like that, we prefer for them to use things like Pamprin, Tylenol, Midol, things like that, as opposed to using ibuprofen.
Yeah. Okay.
Yeah.
That was my question. And then for the recovery, how long would it take for my procedure for you to recover?
So the procedure time's about an hour.
Okay.
Sometimes it can be shorter, it depends. Recovery, so for those first 2 weeks, you'll be on that liquid diet.
Yes.
So you transition to the third week where you're on some soft to puree foods.
Yes.
Recovery for the incisions and everything like that is about 4 to 6 weeks. And then full healing time, really, I usually say about 2 to 3 months.
Okay.
But really by that 4 to 6 week mark is when patients are kind of back to regular.
Yes.
But most patients, just depending on what they do for their job, if
Yeah.
it's a lighter job, they can go back in 2 weeks. If a little bit more labor intensive, about 4.
Yeah. Okay.
Yeah.
Cause that was okay. And was the other question? Like I could still be able to bend and, you know,
Walking around, she's
Walking.
fine. If there's something that someone else can get for you off the floor,
yes,
please
yes.
help her out. As long as you have to. But walking around is fine. And really, the only
Okay.
restriction is that you don't want to lift anything heavy.
Yes.
So 15 pounds or greater for the first 4 weeks, similar to 4 weeks to be submerging into water.
Yeah.
So 4 weeks before you can start to lift weights to the gym, but
Yeah.
you can for sure do some of the cardio exercises. So like walking on the treadmill, stationary bike, things like that. You just don't want to pick up weights to do a lot of core movement.
Yeah.
And those first 4 weeks to just allow your incisions to heal.
Yeah. But I can walk. I can,
Walk,
you know,
stationary bike,
okay.
elliptical,
Okay.
you know, yeah.
So
Especially
we're
after
good
like
on
first
that.
2 weeks,
Mhm.
most cases are pretty good to go back to the gym.
Yeah.
Just no weights
Okay.
for the full 4 weeks.
Yeah. I like that. So
Very good.
it don't require me to be out for a long period of time and So-
Not particularly, no.
okay.
Very good.
Yay! Thank you so much, Doctor. I
You're
love her
welcome.
so much. All right.
Perfect.